I'm Andrew. I've been at Applecross Physiotherapy for the last 15 years. My main specialty area is sports and exercise physiotherapy. So I did a master's 2015. Since then I've been specialising mostly in sports injuries and musculoskeletal injuries. I've also got a special interest area in treating vertigo, so every week I would see a couple of patients with vertigo. Vertigo is quite a common type of dizziness, but it's not the only type of dizziness. So specifically, vertigo is the feeling that the room's spinning around in circles around you. So it's a common feeling to get sometimes normally, like if you spin around really fast on the spot and stand still, the room will spin around, that's also vertigo. But we're usually talking about vertigo being a problem for you when it's making you feel imbalanced and you can't get out of bed or can't walk properly without feeling like you're going to lose your balance and fall over. So vertigo is that spinning sensation. Other forms of dizziness can also occur alongside vertigo or instead of vertigo, which can be like a feeling of lightheadedness or feeling like you're on a boat when you're actually on stable ground. So other feelings of sort of disequilibrium, we call it, but people have all sorts of descriptions for those sort of uneasy feelings of not feeling balanced in your environment. And generally that happens when you're getting mismatch of information into your brain from your different sensory inputs and your brain can't make sense of it and isn't sure if you're moving or if the world's moving around you. The most common type of vertigo is benign positional paroxysmal vertigo, which we shorten to BPPV. So that's caused by calcium carbonate crystals in your inner ear breaking off and falling into the canals in your inner ear. And then as you move into certain positions, those crystals move through the canals and make it feel like you're moving, usually quite fast when you're not moving at all. And again, gives you that feeling of vertigo. So that's very common. The main treatment for that is through positioning movements. So sometimes GPs can do that, but physiotherapists generally are sort of experts in that. Depending on which ear is affected, and assuming that is the actual diagnosis, that treatment's very effective and just involves putting you through a sequence of positions that usually will bring on the vertigo initially, but as you repeat the movement, it will get less and less until it goes away completely. Other types of dizziness can also overlap with that as well. So your neck is quite a common cause of dizziness as well. So if you're not getting accurate information from your neck as to how your head is moving, so if you have a stiff neck or pain in your neck, those things can impact how your neck feeds information to your brain to tell you where you are in space. So again, as part of a thorough assessment, we can determine if that's also a factor or the main factor. We can treat that instead or as well as needed. Also, if you're feeling very nauseous or actually vomiting with vertigo, that's quite common as well. So certainly in recent times, I've taken to not necessarily doing the repositioning movement day one because it often makes you feel worse the first time and can make you throw up. So generally to avoid that, we would do more neck treatment if that's indicated day one to get you feeling a little bit better. And then when you're not so nauseous, then we can still come back and do the repositioning movements afterwards. A lot of patients come to me with a referral from a GP and usually they've been given a prescription for some medication to help mostly with the nausea. It can also help with the vertigo a little bit as well. So that is quite often used. And if patients haven't been to a GP already, if they are getting a lot of nausea, then I'll often refer them to the GP to get that medication as well. Otherwise, most of the treatment is the repositioning movement if it is BPPV. Other common causes of dizziness in general, as I said, most commonly that we would see would be neck-related dizziness. Also, just generally, if your balance overall is not so good, that can be to do with lack of coordination and strength in your whole body. So usually the main areas we'll assess when you come in will be your general balance, so looking at how your whole body coordinates itself through your environment, head movements and head control, the test specifically for BPPV or your inner ear, eye movements, so seeing whether you can track moving objects as you're watching them in your environment, as well as just through the questioning that we do at the beginning, we can also sort of look out for any other concerns that may not be related to physiotherapy and more appropriate to see your GP or like an ear, nose and throat specialist. So the recovery process is really varied in how long it can take. Like if it's in a simple case of BPPV, especially if you're not that nauseous as well, it's not unusual for one treatment to really resolve it. Probably the average would be 2 to 3 sessions, which we'd usually do that over 3 or 4 days, just try and really get it, nail it on the head. If there's sort of more involved, like if you've got a long history of neck problems, you know that your neck's stiff, you've had vertigo maybe several times before, I wouldn't be expecting it to probably resolve within a week or a couple of sessions. But again, that could be anything from a couple of weeks to 6 months. Having been here for 15 years and seen a lot of people with recurrent vertigo over time as well, my experience sort of tells me that people who get recurring vertigo tend to have those multiple layers of other contributing factors going on as well. So like lack of neck movement, ongoing neck pain. And again, sometimes I see those people a couple of times, their vertigo resolves, don't see them again for several months or a year, but then they sort of come back again. I tend to find almost exclusively the people that come back with it repeatedly over the years seem to be the people who don't really address the other components like the neck stiffness and things like that, whereas people who sort of really try and I guess tick off all the components that we've assessed as being suboptimal and trying to get those optimal. Anecdotally, I haven't seen those people come back again with the problem after that time. So yeah, I think a lot of people don't realise, and usually when I start talking to people who do come in with vertigo, there's often some pretty clear signs that they've had some problems in that area for a long time, like every time they do sit-ups, as long as they can remember, they get neck pain, and they've just sort of put up with that, or use their hands to support their head is a really common one, where just with some simple exercises that can be improved to strengthen the muscles through the front of your neck. You don't tend to strain the back of your neck so much, and if you can do that properly, again, you can do those things more comfortably. Usually that means your neck movement improves, your neck feels better, don't get as tight through your shoulders. So again, all those things that are so common, people often just normalize them and assume that it's just something that happens, can be addressed. And again, the earlier you address it, the easier it is to address it quickly. Also vertigo, I think, is certainly more common as you get older. So it's the same thing, I think, where it can be normalized as you get older. It's just part of, losing your balance, losing your sense of awareness of where you are, losing your muscle strength, losing your coordination. All those things do unfortunately happen as you get older, but I think people overestimate how much of that just has to happen and how much of it you can actually stop by doing exercises to target those things. And people can improve really fast as well. I think people are often really surprised how poor their balance is when you test it, when they thought that it was quite good, and then also how quickly they can regain it again or improve it with some targeted exercise.